Just to give an example of some of those populations that where healthcare is sort of a right, are you referring to young children or veterans or other groups that we should be
100%.
aware of?
Yeah. Yes, 100%. So when we talk about healthcare as a right, only certain populations in this country have a right to healthcare. I mean, a right is something that you can, if you do not receive it or do not receive it in its entirety, you can ask for some kind of recompense for, right? So when we talk about who has a right to healthcare in this country, we know, I'll give you some examples. Members of federally recognized Native American tribes, for example, veterans, for example, with the passage of, say, Medicaid and Medicare, which are entitlement programs. If you qualify as for Medicaid, so we're really talking about very low income, mostly children, mostly single moms, and mostly low income disabled folks, even though the narrative is very different, but that's the facts on who's on Medicaid, et cetera. You have a right to health care, right? Under EMTALA, which is a piece of legislation that was passed in the 1980s, if you are at an emergency room and you have been screened positive as having an emergency, you have a right for the emergency room to stabilize your emergency. Now, you don't have a right for them to treat all your other chronic conditions, right? But you have a right for them to stabilize your emergency. These things have all been passed over periods of time. It wasn't like at the inception of our nation, we decided that. That was actually very far from the truth. And the vast majority of these have taken place in the last, less than 100 years. So those are just kind of some examples. And prisoners, for instance, have a right to health care because the government, has dominion over their body while they're in prison. So very specific examples of very specific populations. But the vast majority of us, are not falling within those categories. And so as a right, we don't have a right to health care.